Thank you very much, Thomas. Thank you, all of you. Looks like when there is a session up of women, then there are only women in the room. When there's a session up of younger people, there are more younger people in the room. I'll come to that. First of all, thank you, Thomas, for introducing me. Thank you for being here. I realized that Thomas and myself, we share a passion, a common passion, because on his laptop there are mountains. High mountains, you know, with snow. In Canada, they do have some. In Switzerland, we do have some. Why do I think that's interesting? I think it's interesting because if you look up to mountains, and if you climb up to mountains, you're someone who wants, you know, to change the perspective, to look from a little bit of a distance. Well, that's what you can do when you're high up on a mountain. But you also know that it takes some effort to change your perspective, because before you're up there, it takes a little bit of walking. And, well, yes, we hear a lot about planetary health and One Health and global things, but I think the mountain symbol gets it well together. To get this view, you have to invest energy. That's just what came to my mind when I saw that we are both a little bit mountain hiking. I would like to talk to you about two different things. One is about you in general, and the second one is where do you go if you go with public health, and what could be the future of public health. First of all, you are called the young, and I was, as said Thomas and as Michael said, really enthusiastic to get someone on the board. When I took over the office, when it moved to Geneva, I had the feeling that I was surrounded by, sorry for Michael, he's absolutely not, but only elderly white men. And one of my topics was I would like to change that, to have more diversity, because for a long time in my academic life, that was exactly what I have been surrounded by, elderly white men who mansplained me to a little girl how the world goes. And I started to think that I could have some own thoughts. If I say young, Martha is sitting here, Martha always says, am I still young? It's a difficult concept, you know. It's a very difficult concept. And we had a hard time to define whom we put as, and where is, you have seen 40, 30, whatever. I think we shouldn't start with figures, and we should never, I don't know if some of you have been here when I gave some opening remarks, I think we should never split people up in those and the others. So like gender and race shouldn't be a criterion to split people. I think also age should not become a criterion to split people. Our force is to be together. But this being said, I think there are specific things that you can do when you are in this part of your life where you arrange, where you ask yourself where I go, if you are still to decide your private life, a lot of decisions. I think there you have possibilities that are specific to this part of, let's say, first part of your life. And I would like to give you some ideas. I think when you are in this part of your life where you decide for a lot of things or not sure if you decide, and if you do minimum 4 things in parallel, you want to become an IT public health person and a public health person and a GP and a psychiatrist, and also you would like to be a mom and have minimum 2 children, and when you know, everything is open. Please, first thing, be free and do not copy. Do your own thing. Do what you think is your thing. Do not copy. You do not need to copy. You can try to do your own thing. It's the only way you can really live happily. Do not accept the prepared molds that are there. You know, people would tell you, this is how it works, this is how others have done it. Do not accept it. Have a thought. If the mold fits for you, then it's fine, but just do not go. Second thing I would like to say, ask. Ask questions, ask all the time. I do teach, and I always say when I teach, the best thing that can happen during teaching are questions. Questions get us further in the world. Ask questions to others, but ask questions to yourself too. Ask why, ask how, and that's something important. Try to preserve your creativity. That's a little bit with a non-copying. Every human being has an enormous gift of creativity. We know that if we look at children, they are creative. Do not give up your creativity. Try to preserve your creativity. Try to be able to think differently. And this includes be curious. Look at the things, go to places, see other people, and ask the questions when you meet them. Well, so far for the part what I think what the so-called young group could do and how it is characterized. For me, it's characterized by the creativity, the activism, the visions, and the non-copying and the non-accepting of everything. This holds true probably for people of other ages too, but it should especially hold true for people of your age and of your status, where you move from university, from schools, to kind of what we call professional life. I think that's what I wanted to give you as my thoughts. Now comes the second part, public health. You are here in a congress on public health. What I have seen with people who go into public health, it's very frequently people who are attached to values, and that drives them into public health because they have a feeling for values. They think that there should be, for example, an equal world. There should be the people living in good health everywhere in the world. They have values for the common goods. They think that water and clean air should be accessible for every human being and for animals included. And frequently, it's the values that attract people to public health. It's not always said, but if you go to someone who went into public health and explains you, well, my way was through, first I did that and then I moved up, it very frequently comes out that yes, they wanted to make an impact, they wanted to make positive changes in the sense for values. Now the question we have been discussing in this Congress, especially this morning, this morning session also, and others also is, okay, when the values are the basis what we are doing, and if, as Rüdiger Krech said, the status of health could serve as an indicator or as a compass to how far we are away or close to our values, then I think what we need for public health, for global public health, which for me is public health, is global because we can no longer separate any place in this world out, not Switzerland and not the United States of America, not other countries who want to single out themselves. By the way, national borders are an artifact of the 19th century. Sorry, this was my remark of a historian. Then what do we need and where will public health go? I think a little bit of what is going is in our global charter. I invite you to have a look at it. At our booth, we have it. We need political activity. We heard that the political, economical determinants of health are the most important ones, are the ones that really change it. And so if we want to have an impact, if you want to have an impact, there is nothing but political activity. If I say political activity, that doesn't mean that tomorrow you have to go become a member of a party in your country. No. Political activity for me is a broad range, not only classical political parties. You can be in a local NGO, you can be in a larger NGO, but the thing is that you go and work with others for a change to the better, what you consider the better. For me, saying political work means the way how we can translate values that we believe in into reality. It's a very difficult work, and it's sometimes highly frustrating, but the way to translate values and sometimes dreams into reality is politics. That's how I see it. What I think has to change very quickly, very, very quickly, and this is now a personal view because I'm a university professor and I'm teaching since quite a time. I think our teaching and schooling system has to change in almost all places. At least all the universities I have been in, they are like still constructed according to a medieval scheme, and this is a little bit too outdated. If we say we need leadership, competencies, then they are never taught as the main topic. I have been discussing with students and they said, yes, we should have leadership, political competencies in the broader sense very early on and in all faculties before we start our other topics. And I think that this change in education can come through you, because you have still a very good memory, or you're still in it, what you would like to have had, how you wanted it, what was good, what was not good. So it's for you to say, what we need in schooling is now that. Just let me give you an example. I think we are also teaching things that are no longer the most important ones. We have to go through all our programs and get them off. And when we have done that, then I think we are ready for having you to come to governance positions and create governance. You're already here from Australia, other places in the world. You are working together. We know that we do not have a world government, and I think I'm not going to see one as the things are running, but I think that we can do it in another way, in a world governance on your level, on your collaborations. And if on the level that Ilona Kickbush mentioned, where we said, well, some things globally we have to try it. We see this is perhaps the way to go. We have to try it, and trial is also error. We'll try, you will have an error, you will see it wasn't the right one, but you try it together with others. You will not respect borders. You will not respect the things that make things difficult here. Difficult here, for example, visas and rules and things. I hope that for the next conference we will have a almost no visa thing, because I think that is one of the unfair, unequal things in our world, stop people from moving around. The EU said free movement of people, and I think this should be broader than only in the Schengen era. If you use the spaces that are there to do your governance, I think you can make a change. And yes, indeed, I am very enthusiastic. I am there as the executive director of the World Federation to help you wherever you think I could have a little impact. I'm a small person, but I can have a little impact if you think I can. I wish you all the best for what you're going to do. And I said it to Thomas, it starts with frustrations, and it will be on with frustrations, but you will definitely have the impact, because who else? Or to end with a quote that I like from an elderly German statesman who said, when someone complained and said the people are bad and the people I'm working with are not doing this and doing that, he said, yes, I know, it's very difficult, but take the people as they are. They are the only ones we have on this world.